So I've just opened mcpx, and this is the opening window, and I'm going to hit the green button to expand it, and then I'm going to pick the patients that we just used for training, and we're going to work with Angelina Jolie, and we're going to find her on the schedule, enter her vital signs, and also show what to do if she's not on the schedule, and finally a little bit about the clinical care record. So let's say she's scheduled to come in. So if you want to start with the schedule, you just go up here and click schedule. And if it's been entered, she'll be on here already. So we find this little thing here, and we right click it, and we go down to go to patients. And now we've opened up her record, and there's two things we're going to do first. We're going to go to the ledger, and we're going to give her a incident report, or incident today. So we do new incident, and the incident name should be OV, office visit. If this is blank, just go down until you see OV and click that. The incident type depends on if she's a return patient, or if she's a new patient, or if it's an HPRP patient, and finally if they're here for Suboxone induction. And then whichever one you finally pick, in this case she's a return patient visit, we're going to save it, and we're going to hit Command S. And now it's saved, and you can double check it. You can see that the date's right, it's an office visit, and it's return patient visit. And then we're going to go to the clinical part. And the clinical part consists of the problem list, which has a bunch of stuff entered, allergies, and immunizations, which we never do, smoking, and if you are seeing somebody and you have asked them if they smoke or not, you want to make sure that they have the correct smoking status. Let's say that somebody had this one, which is the default one, unknown if ever smoke, and they told you that I quit 20 years ago. What you would do is double click this and put down former smoker, and since they're not smoking anymore, we uncheck this. If we were going to counsel them today, we would check it, and I always counsel every smoker, and then hit apply. We don't worry about this or this. And then the next thing we worry about is this. So for vital signs, we're going to add a set of vital signs. So you hit click plus, and make sure you have the right incident. In this case, she's been seen before, so we don't want to pick the wrong one. So make sure that you have office visit. Hey, shut up! For today's date. And you're going to put in their weight. She's 300 pounds, 5 foot 1 inch. Don't worry about temperature. Her heart rate is 160. Blood pressure is 240 over 120. And we don't worry about oxygen saturation. And you can put in respiration rate, but it's not required. And then apply. And just to warn you, these are called clinical alerts or clinical decision alerts. The first thing is that she has a hypertensive emergency. So to make mcpx happen, what you would do is click Action Taken, and put in CWC notified. And then she's tachycardic, so same thing, CWC notified. And then her BMI is over 30, so CWC notified. And you're all set. And we've got today's date, and we've got a BMI of 57, you've got her weight, her height, her blood pressure, and you're all set for that. Now, at that time, if you get a chance, you can print off what's called her CCR, or clinical care record. Let me show you what this is. This is the clinical view, which we've been working with, and you can view it as the clinical view, which is the important one, or what's called a CCR or a CCD. This is stuff that applies for meaningful use. It doesn't really affect the patient at all. So you select CCR document and you just print it off. That's it. So Command P, Command P, Command P, and then it'll print off on the printer that was selected. And there's all kinds of other things you can do, but you don't worry about it. Now let's say that a patient hasn't been entered in the schedule. This is what would happen. You open the mcpx screen, and here's the opening screen we just showed you, and you click schedule, and it's blank. There's nobody on the schedule. So it's not a problem. What you do is you're going to find that patient and you're going to put them on the schedule. So all you do is to find a patient, you hit Command 1F, which is Command 1 find, and type in their name. And we're looking for Angelina Jolie. And here she is here. And we're going to put her on the schedule. So we've got her record opened, and we just click schedule. And she's here at 10 o'clock. Oops. And she's here for a 30-minute visit or a 15-minute visit. And that's it. Okay? So now she's on the schedule, and that's all you got to do. And it's going to pull this up, and you're just going to click OK, save. And now we do what we just did before. We right-click, go to Patients, and we're right back in the screen that we were looking at before, and we go right back to the ledger, and we start over. So the only thing we're doing differently is if we don't have her on the schedule, we hit Command 1 find, type in the name, and then enter them into the schedule. And that's it.